Good morning. Welcome to the European Stroke Organization Conference 2019. I am Nicolla Logallo from the University of Bergen in Norway. We are here with Professor Henry Ma from the Monash University in Melbourne, Australia. And Professor, we are here to discuss your recent study, which was a really elegant meta-analysis looking at patient receiving thrombolysis in the late window of 4.5 hours to 9 hours. I wonder if you can tell us a little more about the background and which kind of patient do you select for this study.
Thanks for the nice introduction. Thank you. It's been very fortunate we're able to perform this meta-analysis. It's actually stemmed from the EXTEND study which we just published in New England Journal of Medicine, looking at patients between 4.5 hours to 9 hours of stroke onset and wake-up stroke using perfusion imaging selection. So this meta-analysis included EXTEND studies and the ECASS4 studies, which was recently published, and also EPITHET study published in 2008. So these were patients who actually within the 4.5 hours to 9 hours time window, but using some of them using perfusion imaging selection. So in total, we have 414 patients in the whole cohort, and 304 of them fulfilled the EXTEND imaging criteria. The main result of this is that the alteplase compared to placebo in this extended time window had higher rate of excellent functional outcome, which is MRS 0 to 1, and also able to show in secondary outcome of shift ordinal analysis of MRS also positive, along with MRS 0 to 2 of good functional outcome. The death rate was non-significantly different between the two groups. There was, as expected, higher symptomatic intracranial hemorrhage in the alteplase group. But I think the benefit of functional improvement negates the potential risk of intracranial hemorrhage. So this is the first study we were able to positively report that thrombolysis with alteplase in the extended time window is effective.
Okay, I think you gave us some really good news there, and I wonder if you can say do you think there's any kind of limitation in your study, and if you think that we now have enough evidence to change clinical practice?
Thank you. So first part of the question, do we have limitation? Yes, we do have limitation. Number one, 2 out of the 3 studies were terminated early, the EXTEND and ECASS4, due to obviously a publication of Wake Up and the thrombectomy introduction with the slow down the recruitment. The second is a generalizability of CD perfusion or perfusion imaging. At some centers, this is not available, and the automated imaging selections also can be expensive and cost too. So these are the two main sort of limitation I can see. Now, in terms of are we there now to change practice? I think with one large randomized control phase 3 study, along with a meta-analysis, both with the same positive result, I think there is enough evidence for us to consider thrombolysis in the extended time window. However, there is also the issues about using imaging selection. So I think imaging selection only to help to select a patient better. So I think it's now time to move on to changing the practice.
Yeah, I think I agree with you. I think this is a really elegant study, and will have a really huge impact for the future of thrombolysis in some patients in the late window. And looking forward to read your full version of the study in Lancet. And with that, I wish you the best of luck and a pleasant stay at the conference. And thank you for coming.
Thank you very much for the interview. Thank you.